So my name is Almateria, and I'm here today with Eva Buatsi and Aunty Broabbey. Eva is a breast cancer survivor, and Eric here is an oncology nurse. So it's Breast Cancer Awareness Month, as we all know, for October, and then pretty quickly. There's been a lot of awareness, a lot of discussion on the screens. Advocating and asking people to check their breasts and, examine their breasts. And so we are asking, after the examination, what next? This is the conversation that we want to have. And so I'm going to ask our first panelist, Eva Buatsi, to share with us a bit of your journey, how it all started.
Thank you. As you said, whilst growing, I knew about breast cancer, that it's been deadly. So breast cancer has been, as you say, cancers have been something I've been very scared of. And I've been particular about those things. Reading on health issues, I've been reading on breast cancer too. I've got to get in touch with breast cancer too, and having some ideas about it. So I know that I have to be examining my breast. Growing up, I had to see the doctor. I was having aging issues with my age when I was aging. So I had to see the doctor, and then the doctor suggested that I should come and so that we do some tests on cancer.
Okay.
That's the end. I didn't even go back to the hospital for fear of hearing something which I wouldn't like to hear. So, but I've been trying to examine myself by going to the doctor to run tests for me, to tell me that this is what has happened and that one I didn't want to hear. So I've been around and then having some funny feelings in my breast. So I tried to examine it better. And then one day, it seems my hand touched something, a lump in the breast. I got scared. I wasn't very sure, so I had to go and lie down, because that's what I read of, to lie down and then do the proper examination. I did it and my hand still touched the lump. So, I don't know how to describe.
This was about what age?
Oh, that's growing up, getting to my menopausal time.
Right.
That is, I was having some challenges. That's when the doctor said I should come in for this test, which I didn't go. But I've been checking it myself. So, as soon as I detected it, the following day I was at the hospital. I didn't wait. I got so scared. I knew I was going to die. But even if I would die, I should see a doctor first. So following day, I was at the hospital. Luckily, where I was staying is not very far from the hospital. That day, when I got to the hospital, there were some few people there. They said that day was the doctor's surgery day, so a lot of people didn't come. But we were waiting. When I met the doctor, and I told her what I saw in my breast, I started weeping. Then she asked me, why was I weeping? I said, I didn't want to die and leave my children. I have 2 daughters. Then the doctor said, you wouldn't die. She encouraged me. He said, there is onset of technology, so I shouldn't worry. I'll be okay, I say you. That was the first encouragement I had. And then from the doctor diagnosed me, gave me some drugs, and gave me time to come back. But from the hospital, I went straight to my church to see Osofo. Then I told Osofo, luckily it's a woman. So I told her about what happened. And then she said she understood. And she gave me some counseling, and then we prayed. After that, he's been calling me on the phone, and we've been praying. In fact, within 3 or 4 days, I just felt like some sensation coming out of me when I woke up in the night to pray. And since then till today, I've never got scared of anything again. The fear left me. It went out.
Wow.
And I was ready for anything. So I started going. I did the biopsy. That's the test which is necessary to be run. And then we were due for surgery. So we did the surgery. And after that, we did the treatments, which I expected, the chemotherapy. Then after that, I had to go in for radiotherapy too. So after that, then the necessary drugs, which I'm supposed to take. I've been on. The last one was the hormonal one, which I was supposed to have taken it for 5 days. But 5 years. And then, but along the line, they said they realized that recurrence is coming back, so we should take it for 10 years, which I did.
So you have been on this journey for how long now?
17 years.
Wow. So we'll come back for you to tell us, how you've been coping. But before then, I want Eric to also share with us. Tell us about your role, oncology nurse. What do you do?
Right, so oncology is just a study of and treatment of cancer. So if a nurse specializes in that field, that's what is termed as an oncology nurse. It's a specialty where particular attention is paid to the surface of cancer. But in my case, I deal with breast cancer. Right, so when you come to Kolebu Teaching Hospital Surgical Department Breast Cancer Unit, we first see the patient. All the frustrations are poured on us. In fact, it is on our shoulder that the patient really cries. Because at the consulting rooms, much time is not given because of the volume of work on the doctors. So when they leave there, they come to us and they really pour their frustration on us when diagnosed newly, because it's never easy to be told that you have cancer. The first thing that comes to your head is, am I going to die? That's the first thing. Am I going to die? So when they come, they really need an encouragement, as Mommy mentioned. And encouragement is very important. That's the key role that we play. First, we have to let them be at peace, encouraging them that there is help. You can be cured. Don't worry. Then after that, we take them to the series of counseling, what is expected, treatment regimen available for them, the options for them to choose from. That's the counseling that we also offer them. And then eventually when they come on the treatment, especially the chemotherapy, the side effect alone is quite burdensome on the patient. So we need to educate them that they will be experiencing this and that whenever it comes, we are always there for them to call, that we guide them on what to do. So we also manage the side effects for the chemotherapy. When they come to surgery, again, counseling is needed because there are a lot of types of surgery, right, where the entire breast is removed. It's not easy for a woman to lose one of the breasts. So we need to also sit them down, explain to them the need for them to go to that surgery. If it's lumpectomy where the lump is also removed, we need to explain to them. And then from there, as Mommy mentioned, they go to radiotherapy. We need to also take them to what is expected, how many times that they will go. And then we also do navigation, where the patient comes from, at what point, which steps she to follow throughout the course of treatment. Yeah, so we do a comprehensive care for the patient.
So, share with us some of the highlights or some of the key moments, the special moments that you've encountered with these patients.
Well, so I mean, when they come, you should expect that psychologically they are quite unstable because of the hearing of the cancer. So at times, by the time they even come from...
So it means that by the time they're coming to you, they already know they have cancer?
Yes. They might have gone to the consulting room.
What's the first point of call for, I've examined my breast and I am feeling some lump. What do I do? Right,
so this is the process. So you felt a lump. You first come to hospital. Let's say you've come to Kolebu with a referral. So you first have to go to a clinic nearby. They'll give you a referral. You come.
So I can just walk to
any clinic at all and tell them you felt a lump.
Okay, see a general practitioner.
General practitioner.
Right.
He or she will give you a referral to Kolebu.
Okay.
So when you come, you first go to the consulting room.
So I just want so that, I mean, our audience or our viewers can be able to follow the process very well. So if they're referring me, they're referring you to the breast cancer unit?
Yes, directly. At Kolebu, directly.
Once you fill the lump?
Yes, they will refer you.
So then they haven't diagnosed you whether...
No, we don't even know what is in it.
Right.
Yeah. So when you come, you go to the place of registration and those things, join the queue, and then you see the physician or the surgeon in this case. So when you get to that, he also examined, we call it clinical examination, where you will use his or her hand to palpate, to really confirm that there is a lump. Having done that, then you also go to some investigations, the scans, the mammograms, then the laboratory test, you go through all that. Again, the only thing that we can really say that what is in there is cancer or not is what we call the biopsy, where a sample of the lump is taken to the pathology lab to be examined. So they are the only people, only people that can say that what you have in there is either cancerous or not cancerous, right? And again, if it's cancerous, they go further to give the staging, the grading, and a lot of information about what is in there. So if it's not cancer, it can be removed easily, and there you go. But if it's cancer, if it's malignant, we do further test, we do further examination. If really confirmed, then we look at the size of the tumor in there. We look at, is it movable or is it attached to the chest wall? So we consider a lot of factors. Then either you start chemo or you go upfront surgery first. Depending on those factors, even the physical health of the patient also matters. The financial standing of the patient, we also consider that. So if basically most of them start with the chemo, right? So you start with the chemo, you do 8 cycles in all. At times you go more, but 8 cycles, you do 8 cycles. And then in between, we'll be assessing you. Are you responding? Are you not? Is it partial response? We factor all that. Then whilst on chemo, we'll be preparing you for the surgery, where you go and see the anesthesia team. They also assess you, so that after the chemo, then you can go for the surgery. So the surgery, either the whole breast is removed depending on the stage or how far the disease is gone, or just the lump that is going to be removed, right? So these options are there for the patient.
So as you were speaking, I was just thinking of somebody. Let's say I am in Nalarugu somewhere, and then I've heard about the awareness, and so I try to examine myself, and then I find a lump. Are they going to refer me to Kolebu?
Right. So oncology services are not available in all the hospitals. Wow. Even some of the district hospitals, they don't offer that services.
Wow. So how many regions have?
So I think all the teaching hospitals, Tamale Teaching Hospital, Konfanoche, Kolebu, Cape Coast, and I think now Takrady also runs some services with oncology, and the whole too is also started also doing something. So if you are in a typical village and you detect a lump, you have no option than to travel to where you can access oncology services, right? So if you are at Narugu, as you mentioned, you detect a lump, if it takes you 4 hours to get to Tamale Teaching Hospital, you have to, because you have to travel that long.
This is worrying. It's concerning. That's and so I want us to come back to Aunty Eva and to tell us a bit about how you coped with the journey. I know you talked about how, the fear left you, but then hearing what Eric, all the processes and the stages that you needed to go through, how did you cope? How did you manage this?
Oh, luckily, as I've already said, the hospital is not very far from me.
Great.
So I go there when and what time.
As in when you want,
when
you're able to go.
If that is when there is a need,
right,
or when there is an appointment.
It's easy for you to.
It's easy for me to go. And then I was just particular about trying to adhere to whatever medication they've given me. I remember there was a time I had to go, and I took my daughter along, my big girl along. I have 2 daughters. I took the big girl and she accompanied me. And then when I was talking, I'm a retired teacher. So when we were getting ready for the chemo, because of how horrible it is, the doctor told me I'll be taking some weeks off, at least 1 week off from school. So I complained about, then my final students will suffer. First of all, I said, then my children will suffer. This is the expression I gave. So she thought I was talking about my child. I said, I said, did you come with your child? I said, yes, but she's not the one I'm talking about. I'm talking about my school children. And I said, you have to be strong before you can go and teach them. If you are not strong, you are not fit, you can't teach them.
Right.
So you don't have to think about that. So I did my chemo for six rounds. And for these 6 rounds, every 1 week I stay in the house. It got to a point where I realized my headmaster was getting agitated until he came to visit me in the house and saw the condition. So hearing that my daughter was around, she asked me how old is she, and when I mentioned it, I said, let her come and see me. That was the day I was going in for my first chemo. So they rushed me out from the consulting room to go in for chemo. The nurse came and took me away, and then not knowing, the doctor was examining my daughter, knowing about her age. Because as they say, it can be family issue. So I was at the ward having this thing when she came to me and said, the doctor prescribed this. The doctor examined her and prescribed some drug for her, and that I should give her money to go and pay. Not knowing, doctor saw lamp, but doctor told her not to tell me.
Wow.
Until she removed the lamp. Even until she removed it, I didn't know. She came for review before she told me. That doctor said she shouldn't tell me.
Wow.
And then, so by then she was in Accra and I was in Kumasi. It was when she came down that she told me. And then the doctor told my sister too, who was attending to me, not to tell me. So everybody did it. So the day she was coming for the surgery too, it's my brother who sent her from Accra. They did the surgery that day and they left without passing the house. Wow. But they examined the lamp and realized that it's not cancerous.
So that brings me to early detection.
Yes.
Early detection.
Yes.
And the importance of early detection. Share with me, Eric, what do we do? What do we look out for? So that I know that what I'm seeing is at this level, or what should we look out for?
Right, so Early detection is key. As we say, it can save your life. If you see it early, it really saves life. We say this because cancer is a disease that can spread to other parts of the body, right? So it can leave the breast, can go to your bone, can go to your lungs, can go to your liver, even to your brain, right? But if you see it early, where it starts from, if you see it early, we can just take off that session. You might not even need chemo or radiation, and then you are good to go. But if you don't see it early, what it means is that it means the cancer has taken over the entire breast, probably spread to other parts of the body. Okay. How do we know we've seen it early? In advanced countries, what they do is they know that between the ages of 40 and 49, woman is at risk of developing breast cancer. So immediately you are 40 years, they call you, wish you happy birthday, and also remind you that please come for breast cancer screening. If they call you 1 or 2,
they are not waiting for.
No. If they call you 1 or 2, you are not coming. They will take their van to your house and screen you.
Wow.
Yes. So they will take the mammogram, and the mammogram is a machine where you can even detect the cancer before it starts. We call it the pre-cancerous state. The mammogram can detect it before it even becomes cancer. So it means before the cells start even misbehaving, the mammogram will see. But our part of the world, what we see is we will just see a lump and we say we've seen it early. But before you see the lump, it means that the cancer has been in you for quite a long time.
Okay, but seeing a lump is not necessarily cancer.
No.
Okay.
No. As I said, we have 2 types of cancer. One that we call benign. As mommy said, her daughter's one was benign. Just remove, she's good to go. And the one that is malignant, right? That one is dangerous. That one can spread. So seeing a lump, you cannot tell whether it's cancer or not unless you do further investigation. But the seeing of the lump and you keeping quiet, okay, you might not tell, you may not be lucky. It may be the malignant type, right? So it will be growing, then it can take over. It can even become sore, where the whole breast is ulcerated, giving all sorts of offensive symptoms and that. So if you see it early, it's very key. Now, how do we see it early? Every woman should know how the breast look like. That's the first point, right? If you know how the breast look like, and anything is developing on it, you see it early. Like you are driving, you know the sound of your car, and they eventually changes. So no, this is not the sound of my car. You pass by mechanic, they check for you. So if you know how your breast looks like, if there's any development at all, you recognize it, right? And then also, with women, I mean, we like looking on our faces, makeup, but how many of the women, really look at their breast, right? You can just be in front of a mirror, hold your waist, just let the breast be, and just be looking at it, right? Just be looking at it. If one is becoming bigger, you know. Mostly, breast cancer is not painful. So if you are waiting for pain, before the pain comes, it's advanced. Yeah, it's never painful, right? So if you stand before the mirror, you see the size, right? You look at the skin, the color of the skin. You look at the nipple. One way that breast cancer develops is the nipple being put in. So you have a projected nipple, and then all of a sudden you see the nipple going inside. The cancer can just let the nipple go inside like that. So immediately you see that, you should know that there's something wrong, right? At times you see the skin. The skin will look like a skin of an orange. See that small holes, exactly. So if you see that developing on your breast, then definitely there's something wrong.
It's not hairs.
No. No, you will see it, right? So any changes at all you will see on the breast, that is not usual of your breast. It calls for medical attention. And again, you see our armpit is part of the breast. Right. The top of our collarbone here is part of the breast. So when we examine, we should pay attention to the armpit. Yes. At times, breast cancer can start from there. The breast itself will be fine, but the armpit may be developing cancer. So you have to palpate the armpit. Is it hardened? Is anything developing there? You see it. Yeah. So when we do this, when we do this, if anything is developing, we will see it. And then let me also stress on a mammogram, right? As I said, before it even starts developing into cancer, mammogram can detect. So if you have a family history, right, at the age of 40 years, at least you should have one mammogram done every year. Every year. Just save towards it and have one mammogram
What's
done.
the cost of having a mammogram check?
It depends. It depends on where you would like to do it. If it's a private section, definitely be much expensive than the public.
The average?
Average costs of mammogram, let's peg it between 250 to 300, if I'm not mistaken.
CVs?
Yeah.
Okay.
The last time I did mine was 260.
260. Okay.
A private section, right? Okay, so Kolebu will be much cheaper.
Right. So, I mean, talk of early detection, talk of like going for this mammogram checks, and how accessible is this mammogram? Is it in every hospital? I mean, the teaching hospitals, as you have said, do we have it at every hospital that I can just walk in and say that I want to have a mammogram check?
Yes, this machine is available in the teaching hospitals. So for a fact, all the teaching hospitals are, but I think I'm told the 3 northern regions don't have mammogram. I'm told. Yeah, so and it I think last year they were screaming that they need mammogram machines. It means that if you are in any part of the 3 northern regions and you want mammogram taken, it doesn't come to Komfanoche or Kumasi. And there are private ones. Yeah, but for the public ones, I think it's not easily accessible at that. It's not easily accessible at that. The southern sector you may get, but going to the middle bit up there, it's a bit scarce.
So I know that you are doing a lot of advocacy around like in outreaches. How has the response been like, and what has been some of the challenges with the outreaches?
Right, so with my experience, I think we are dwelling much at the city, the urban areas, Accra, Kumasi, Takoradi. But the remote areas, there are also women there that needs to be screened. So this year like this, we went somewhere in the Hafu region to just help the women and give them education and also screen them. And the cases that we had, I said, wow. So it means that we are in Accra making noise, you know. So I think that more needs to be done in these remote areas, right, where even accessing healthcare is a problem. Because the district hospital, the chief compounds, they don't really know much about breast cancer, not to talk of going to educate the women about it. Yeah, so I think we should do more. We should rather turn our attention to the women, the less privileged, for lack of a better word, there, so that we can really help them. Rather than that, we may think we are fighting it here in Accra, Kumasi, Takoradi, the Cape Coast, but those in those areas may also be suffering. Yeah.
And in terms of partnerships, how accessible or how are people willing? How willing are people to partner with the outreaches so that you can be able to go out there and do a lot more advocacy?
Great question. So, one were the days where we were not having breast cancer organizations to even support patients financially. But now, we thank God, we have organizations who are doing so well in terms of supporting patients financially, in terms of education, going to secondary schools. You know, as I said, when we went to Ahafo, we visited Ola girls and we educated the young ladies about breast cancer. We screened them as well. So I think that we should just start from the base. It's like we are losing the fight on the adult. So let's go to the younger ones, educate them. And I'm sure they will also go.
Who also gets the cancer?
Yes, I mean, the fact that you have breast,
yeah,
right? I mean, the fact that you have breast, you can develop breast cancer. So with the partnerships, yes, if I'm permitted to mention some few organizations,
sure,
right? So, Pink for Africa is doing so well. We've been supporting patients over the years with prosthetics. That's when the whole breast is removed. What's the word? The silicone that you can put there to just, look fine. Yeah. They've been distributing it. Last 2 weeks they were at Kolebu. They distributed about 50 pieces. They donated 40,000 Ghana cedis to help the patient go through treatment. Then one Cancer Support Network Foundation. For this organization, it's their aim that they will be going to the remote areas. So as I mentioned, we went to Jomolo last year. This year we went to Ahafo Kenyasi to educate the women. They also support financially. If you call on them, they will just come to your aid and support you. Yeah. So Mina Breast Cancer Foundation is also there. So these organizations are all they're doing wonderfully well in terms of education and then supporting the patient. So if you are home and you think you don't have money, so you've seen a lump and you are not going to the hospital, please come. There's always a place.
Where do we come to?
No, just come to Kolebu. Okay. Yeah, just walk to surgical OPD. Just tell the nurses that you found this in your even if you don't have the referral.
But if I'm in Nalawibu,
so just get to Tamale Teaching Hospital.
And the outreaches are there, the partnership, the advocacy.
The nurses will contact the NGOs.
Okay.
I think you'll be directed where to go.
Yes. You will be.
Yes.
Okay. Yes. This brings me back to you, Aunty Eva, about the support. He's talked a lot about how there are NGOs that are supporting people to fight breast cancer, but what kind of support did you receive yourself from family? What support would you say you have leaned on the most that has helped you to fight this cancer?
As you said, both physically and spiritually.
Right.
From the family, very strong. My family was strongly behind me. And friends, churches, and then prayers, all these things were around me. So I wouldn't say I suffered so much with this treatment.
But you know that typically this disease is not one that people like to talk about.
Yes.
And so people would shy away from letting people know that this is what I'm dealing with, for fear of the stigma and all the things that comes with it, right?
Yeah.
And how people will be looking at you, all of those things. Did you have to do that? Did you have to keep it away? Did you have to just, how did you manage communication around this?
I didn't believe in those kind of things, to shy away when I have a disease or something like that.
Yes.
I didn't believe, so I was open. I was sharing my sickness with others, what was going on, if they could. In fact, the night, I detected the lamp in the night. Deep in the night, I was watching late movie when I was feeling my breast. That night, when I felt it and I realized it was a lamp, that night I called a friend, a nurse. There and there in the night. And I called her, she was sleeping. I woke her up in the sleep and told her what has happened. Then asked her where to go. This is a nurse at Kolebu. I come for Noche. So, but it's not with the oncology department. So I asked her, where should I go? Then she told me to go to Peace and Love Hospital. This is about 17 years ago. 17 years ago, when I went to Peace and Love Hospital for surgery, even where they did the surgery for me, the roof was no roof.
Wow.
He was putting up the building, but it's a story building. So we did it, the surgery on the ground floor.
Wow.
The building was no roof before they did the surgery for me. Just to show how, and as at that time, I should say Dr. Beatrice Guafiada is the first doctor who started with this advocacy thing. Going out to markets with megaphone.
Wow.
trying to, in the market, call them to come. Even when she told me when she started her surgery, because she didn't have hospital or clinic, she was doing the surgery in other doctors' hospital. And then there was a time I was being interviewed at an FM station, and she was in Accra. She was listening from Kumasi when she wanted to contribute. What she was asked is, "You are a doctor?" He said, "Yes." And a surgeon. He said, and then, "Why breast? Breast alone." Then she said she wouldn't be at the theater just for bad breast to be brought to her, just to cut it off, and then the person goes to die. Another time, another bad breast has come, you remove it, then the person, no. So she decided to, she realized there wasn't much awareness. And so she decided to go out and propagate it, let people come for screening when they detect. So from that, after this thing, she has got a Survivors Association, in which I'm a member, even the vice president of the association. And she has got this NGO, Breast Care International, where she has been advocating for drugs and funds to support us. So sometimes we go and get drugs without paying. We don't pay. Whenever she has got something like that, when we go, we don't pay. The national insurance too, she tried, and we were drugs which, you know, these drugs, you wouldn't get it free, but you pay at least about half or 1/3. But along the line, health insurance too was not paying her. So with the insurance, she has stopped. If she has got there was even a time that drugs from outside came, and got stranded at the port for it to expire.
Wow.
Because the necessary papers were not processed. So there is a lot of challenges with these things. And then out of this, in our case, as a private hospital, also this, out of this association, the Survivors Association, some of us have been picked, educators, trainers, to be counselors for newly diagnosed patients. So we go, whenever he's running the clinic, we go. And then the newly diagnosed patients who have been crying, as you said, we have to tell our stories to encourage them, so that they know that at least somebody has gone through this. So me too, I can go through. And then we navigate, we follow. Have you gone in for your drug? Are you due for, which day are you due? Have you gone? Did you go to see doctor? Have you done your radiation? All these things, how many days? We follow every day. Otherwise, some of them will even get up. They will decide that today I'm not going, I'm tired. Especially the chemo, which is very, very horrible. But if you try to push them, they overcome it and get through it. So when you finish with the treatment, you are a survivor. Then you join our association. Yes.
Wow. I mean, it's very encouraging to hear all of the support systems that are being, that are coming up to support, women who are battling, cancer. And so I'm interested in hearing how the spiritual support bits, because one of you mentioned that when you first felt the lump, or I think when you went to the hospital and they told you this was the first place that you went to was the church. And I know how sometimes we hide behind our faith. I don't know whether it's actually fear and not faith, but we front it as this is faith, that we believe that we are well, we are not and so we do not follow through on the medication or the procedures that we need to go through to actually receive the healing, because we believe that by some way, shape or form, it will just vanish. Have you had that experience? Have you had to deal with that kind of mindset, that kind of perspective, that kind of advice? Because I'm sure that a lot of people would because if you were telling people, and the reason why people don't even tell people is because it's very advices, like a lot of people coming with their opinions. So how did you manage that?
Should I say I'm lucky?
You were fortunate, huh?
I've said this one, that I'm fortunate to be a single parent.
Right.
And a friend of mine saw it as a good solution. Maybe it's because I'm a single parent, that's why it was so smooth for me. Because my support, if it's not from friends, and it's not from church, then it's from my family people who are around me. Now, with that, the church, being a Christian, and my belief is the fear. In fact, when I got to Osofo, the first thing I said, Osofo, this is what I've done. I've detected lump in my breast, but fear wants to kill me if you can help. This is what I told him.
So this goes to say that even fear kills most people faster than the cancer itself.
Yes.
Right. Right. So there's nothing to fear
at all. That is why with that, my faith is to see Osofo, and then Osofo encourage me. And with the prayers, I know very well I have to pray, but with somebody's support. So with that prayers, to be frank, I felt it like something coming out of me. After that, the fear is gone. Just within 3 or 4 days, and it's gone. Since then,
you just face the bold.
I just face. If I'm due for treatment, I go in. If it's for prayers, I pray. I don't. Apart from Sopho, after the surgery, Sopho came and visited me in the house. We pray. Sopho has been calling me on the phone. We pray. Apart from that, it's my own personal prayers, my siblings' personal prayers in the house. I don't go any other place. I talk with God. I give myself to God. This is all.
This is powerful.
Thank you.
Yeah, but because I mean, the default is to keep it to myself, not to share with people. So it's interesting to hear how even just sharing the problem lifts the burden, has lifted the burden off you, and actually made it lighter for you to.
It gives so much hope. When you share it, that's why this association, sometimes when we meet, we discuss our issues. This is what has happened. Some people along the line, they will die. Yes, we hear of people who died. We sometimes visit some of them at funerals and things of that. But still, when we meet, we encourage each other. There was a time I couldn't go to Kumasi. Doctor sent for us to the association from Accra. We have Accra and Kumasi. We went to meet them. They went to meet the Kumasi people. I couldn't go that day. I was sick. And then when they were coming back, I called to find out whether they reached Accra. And then they said yes, they were almost in Accra, but there was an unfortunate thing which happened in Kumasi. I said, what happened? Said they were all busy. When we meet, we jubilate, we praise God, we sing, we dance. They were doing it. Then people started sharing their issues. One lady, a Muslim, came with a small girl. She said she lost all her children, leaving the grandchildren. So it's that child who has been accompanying her to the hospital.
Wow.
And then she was giving testimony, very happy. I don't know what happened. Then she started falling down. Fell. They rushed her to the ward. By the time they left the place, she passed on.
Wow.
And you know, we meet and we share. We share, and when you are sharing, you have ideas. You have new ideas, and then you learn from friends, and they also learn from you.
Right. But you seem like you haven't had down moments. Like from the way you're telling us about like how you fought it, how you shared it, how you faced it boldly after the fear left you.
The only down moment I had.
Right. Tell us about it.
That day I detected the lump.
Wow.
which I wept. The following day, I went to hospital, which I wept to the doctor. When I got to Osofo, I didn't weep. I just told Osofo, I'm scared. Fear wanted to kill me. This is what I told Osofo. And then when this fear left me, I'm okay. I'm okay. And then one day I went to the doctor. Doctor looked at me and said, hey, Aunty Eva. And I said, what is it? He said, come and see. By then I was in Kumasi. Come and see my Accra office. All your nieces have lined up. The Buatsis have lined up. They came for screening. All my nieces have gone for screening because of me.
Yes.
And then when we laugh over this, they say, anyway, you have given them the hope. It's because of you. If it's not you, they wouldn't have come.
Yeah.
Apart from this, my daughter, who had lamb, the second one too had. As of her, because of the knowledge, she herself was touched and saw 2 lambs. She took it, but then she was in secondary school. They took it to the doctor. The doctor said, oh, you finish school and let's see. They finished the lamp, they gave her some drug. The lamp was not going. They just removed it. The 2 lamps finished. And she's okay. So I don't think I've ever had any, apart from the chemo, which is so horrible. Even that, I was stronger than it.
Right.
Because, excuse me to say, some of them, their private parts will be sore. Their mouths will be sore. Eating will be very difficult. But all is when you have the high spirits. I know what I was eating to suit my mouth. Vomiting. Whenever I enter the sitting room and the kitchen is there, I say, close the door, close the door, close the door. I don't like the scent of, I will start vomiting, but I never vomited.
Wow.
Anytime I went, doctor said, do you vomit? I said, oh. Some people, as soon as they start giving them, they start throwing up at the ward. But I was so strong. I think I was strong. I was ready to face
it.
Yes, to face any situation. So I don't think I've ever had, apart from the day I wept for the doctor and myself in the room, it's only talking to God. I talk to God a lot, and my siblings too, they did.
Yeah, it's powerful. So Eric, I mean, we want to wrap up, but before then, I mean, as we're wrapping up, if you can just throw in some words of advice, if you had to advise any young girl, any young woman, what would it be?
Right, so before I come to that, let me just comment on Auntie's submission. I think she's a very strong woman. Yeah.
I've known her and I always tell her, you inspire me a lot. I've never, all this that she says that, or she tells people, you would never meet her and she has down spirits, you even be like, why are you down?
Yeah.
You have to match up her energy.
Yeah.
No, you have to match up her energy.
Yeah, I can just relate, as she was just, talking. So the point here is, just imagine when she went to Osofo, and Osofo also said something negative to her, she would have gone down, you see. So we all need encouragement, especially those going through cancer treatment. And so this year, our team is stop the stigma, be supportive. Yeah, stigma is not good, right? Cancer is not infectious. And if someone is going through, the worst thing you can do is to stigmatize the person. No. The person will rather go down, right? So let's be supportive. We all need each other, right? So family, community. A patient related a story where she went to the pastor's mommy did to tell the pastor that this is what I've been diagnosed of. Remember me in your prayers. The next Sunday, the issue is on the podium. And even where she sat, right, because there's also for use there to preach, she couldn't go to church the next Sunday. Where she sat, nobody sat there.
Oh.
Just imagine. Okay. Even community. And that's why people don't want to come out. Right? There are a lot, but they don't want to come out because people may think that, hey, cancer, you are going to die, which is not true. So please, let's support them. If you know anybody going through cancer, it's not easy.
Right.
It is never easy. Let's support them financially, psychologically, emotionally. Right? Let's provide that avenue for them to cry on our shoulders. Right? Let's encourage them. Right? So the advice I will give is that breast cancer is real and it is killing. In fact, 2022, right? New cases that we had in Ghana is 5,026. New cases. They are not part of those that have been diagnosed previously. New cases. And studies suggest that between 30 and 40, this is where we have the cases. Right? And half of this dies. And these statistics, those that comes to die at the hospital that we're able to count. Imagine those that died at home, prayer camps, herbal hospitals. So it's really a matter of concern. Right? So I will advise every woman that if you have breast in Kwadia, please take care of it. The moment you have breast, take care of it. Try to look at it.
You don't even have to think that, oh, I'm not within the age bracket.
No. Or I have family history. None of my family members had
history. No, so I can't
you can start somewhere. If you ask mommy right now, do you have a divorce? No. Then you be that. You can start somewhere.
In my case, for instance, when I was reading and inquiring about it, I learned even if in the family history, if it's on your mother's side, you are at risk more than father's side. But mine is rather on the father's side. You understand?
It's not entirely true.
So you can't really, you wouldn't know where
it will come from.
It will come from. Because my grandmother, father's mother, she died of cancer of the stomach. Her sister, when she died, my grandmother said when she died, there was a trace of cancer.
Wow.
That's where even my brother, we were chatting, then my brother said, since they said it's family matter, we should go and check. But I was scared of going for them to tell me
there's something.
So I wouldn't go. And that's it with everybody.
Yeah.
But now we have, once they are that time awareness was not there. I was giving a talk at the place. I said when I went the day I went in for the surgery, it was in October. And October is supposed to be pink month.
Yeah.
When I went to the hospital, there was no pink. Not even the doctor was wearing pink. Because the awareness was not there.
Right.
You understand? Right. She was trying to, but until there was some international program where she picked it up. And then we started putting on pink before we started decorating the hospital, showing the pink and all those things. Initially, about 17 years ago, there wasn't any pink anywhere.
Yeah. So with this, if I mean, the advocacy is happening only in October.
After October,
what happens? Yes. Or should I only check in October?
The advocacy is there. It's only that it's not very on a large scale as in October. Especially with we the survivors. We can't stop talking about it.
Right.
It's there. Okay. It's only that it's not on a large scale as where we have to go and walk and talk and do all those things. The only thing is that we should keep on. As October is just a month which is
out of 12.
Out of 12, just a month to maybe propagate it for some time, and that's all. But as for them, when you go to Peace and Love Hospital now, the staff, the nurses, they always put on pink. Always put on pink. You know, anything breast, anything they come. You understand? But it's only that it's on a large scale. But when I go out now, whomever I meet, I talk about it. I have a new house help. I took her to hospital yesterday. I went and saw the doctor, and the doctor said, there's nothing wrong with you. When I came out, I called her and I said, we have to be praying always. Do you know prayer is good? I just saw the doctor. I said, there's nothing wrong with me. Then I started telling her about my cancer. There and there, just yesterday. Today, when I was leaving the house, I said, have you seen my breast? It's because of cancer. Do you know what cancer is? So with us, we talk.
And then just to add up, I also advise our men, right? So 1% of the cancer population are men. So men can also suffer the disease and go through the treatment as the women does. So the married ones, what I will ask them to do is that when they go there, right, to enjoy themselves, they should also check, right, if there is any abnormality there. So mostly when they come, most of them say, well, my husband saw it. My husband saw it. So we will encourage the men to go there more, and they should go there more.
I mean, every time.
They should go there.
And then how about, going to, right now they're offering a lot of free screenings at various places, vantage points. But after October, if I want professional screening, I can just walk to any hospital, right?
Yes. So Kolibula days after October, you can walk to the surgical department OPD. You can go to the radiotherapy, free screening for you. I think on Tuesdays, Tuesday afternoons. But you can equally walk to any clinic at all. I'm sure clinical examination, any nurse should be able to do it. But more importantly, you yourself, right? You yourself, you'll be able to see it faster than.
So we need to pay attention to
You need to pay attention, especially self-breast examination. So 3 to 4 months after your menses, just examine the breast. Make it a point. Yes, 3 to 4 months. During your menses, the breast become tender and sometimes even become painful. If there's something, you may not be able to detect it. But 3 to 4 days after the menses, where the hormonal changes are taking place, just examine it. It's not difficult. Just examine it, check to your armpit, and then you are good to go. So let's do that, and we hope that we'll advance to reduce the mortality rate of breast cancer in Ghana.
Thank you. It's been wonderful having both of you here. Thank you for this conversation. So you've heard it all. This is just a little that we can see here. You've heard how we need to check our breasts regularly. There are various places where you can go for screening. At every point in time, make sure that you are checking, you are examining your breast. You know your breast better than anybody else does. So check your breast all the time. Don't wait for Pink October to check your breast or to have it screened. There are hospitals that are screening. Go there, have yourself checked, have your partner checked. Also, we're looking to inviting a lot of people, as many that can support these advocacy groups, this cancer NGOs, breast cancer NGOs, to come in and support. You've heard how even in the north there are no mammograms, and a lot. For us to be able to combat this cancer, to be able to save a lot of lives, we need all of you on board in any way, shape, or form that you can support. We are also going to see how best we're going to pledge our support to the cancer support network, and so stay tuned.